Welcome to our message on the Christian and the science of human reproduction. In the West, we've seen another US election where abortion was a key issue. It's a very polarizing issue in America and many other countries. Positions become entrenched, and it becomes an issue of who controls the US Supreme Court as to who gets their position as being the current law. This is not a way to resolve the confrontation of views, nor is the US solution of transferring the decision process to the individual states a satisfactory answer. But in studying the issue, it's apparent that abortion is part of a bigger picture, and so the approach that's being taken in this message is to present the facts about the science of human reproduction. Future messages will look at other aspects of the Christian and human reproduction. So let us begin. When human life begins. In 2022, YouGov conducted an opinion poll that found the following results. While the highest response to the question was life begins at conception at 29%. This was matched by 29% either in the third trimester, where the baby was able to survive a premature birth, or at birth itself, with 11% unsure. The difference was more remarkable when looking at the pro-abortion, pro-life split. 50% believe life begins at conception of those essentially opposed to abortion, compared to 10% of those essentially in favour of abortion, versus a 13% in the third trimester at birth, versus 43% for the same groups, with 7% versus 15% not sure. For those who indicate they believe life begins when the fetus can typically survive premature birth, this is establishing a variable beginning date. When Roe v. Wade was passed in 1973, the viability date was approximately 28 weeks. Today it's approximately 22 weeks. But that's dependent on the most up-to-date facilities, equipment, and staff, which can vary from town to town in the US, let alone from country to country around the world. The smallest baby born to survive was 8.6 ounces at 23 weeks and 3 days in 2018. 3% of respondents to the survey incorrectly believe that life began at ovulation before the egg is fertilized. So let us start by looking at the science. From the American College of Pediatricians report issued in March 2017, and their abstract was, "The predominance of human biological research confirms that human life begins at conception, fertilization. At fertilization, the human being emerges as a whole, genetically distinct, individuated, zygotic living human organism, a member of the species Homo sapien, needing only the proper environment in order to grow and develop. The difference between the individual in its adult stage and in its zygotic stage is one of form, not nature. This statement focuses on the scientific evidence of when an individual human life begins." The report goes on to say that it was with the advent of the cell theory developed by Schleiden and Schwann in 1839 that it was recognized that the embryo develops from the single-celled zygote. In the last century, and particularly in the last decades of the 20th century, much more detailed observations have been made of the first 24 hours of the life of a human being. During this time, the cell membranes of a sperm and egg or ovum fuse and the first cell division occurs. When during this 24 hours does a human life begin? Embryologists are less united on this question. During the first 24 hours, once the sperm and egg bind to each other, the membranes of these two cells fuse, creating in less than a second a single hybrid cell, or the zygote, or one-cell embryo. To protect its bodily integrity, within minutes, the zygote initiates changes in its ionic composition, releasing zinc in a spark that induces egg activation, first modifying the surrounding zona pellucida, blocking further sperm binding to the cell surface. Cooperation between sperm and egg components to achieve replication of the DNA, cell division, and growth occurs as maternally and paternally derived factors in the zygote begin interacting with and chemically modifying each other to initiate the final round of meiotic division in the maternally derived nucleus to enable DNA replication. Finally, the nuclear membranes of the pronuclei break down in a process called signomy, technically pronuclear membranes. No nuclear membrane encompassing both pronuclei is formed. Rather, mitosis occurs, and two cells, each with its own identical nucleus encased in a nuclear membrane, are formed. Some embryologists consider fertilization a day-long process and regard the beginning of human life as occurring near the end of this process at synagamy, whereas others consider the time of cell membrane fusion, when the embryo gives evidence of being a different kind of cell rather than the oocyte, which is an immature egg cell or sperm, to be the beginning of a new human life, since within minutes the new embryo acts to prevent the merger of another sperm with itself and starts the business of self-replication. The single-celled embryo is a very different kind of cell than that of the sperm or the oocyte, and contains a unique genome that will determine most future bodily features and functions of his or her lifetime. An organism is defined as 1. A complex structure of interdependent and subordinate elements whose relations and properties are largely determined by their function in the whole. And 2. An individual constituted to carry on the activities of life by means of organs, separate in function but mutually dependent, a living being. It is clear that from the time of cell fusion, the embryo consists of elements from both maternal and paternal origin, which function interdependently in a coordinated manner to carry on the function of the development of the human organism. From this definition, the single-celled embryo is not just a cell, but an organism, a living being, a human being. The report continues, the American College of Pediatricians concurs with the body of scientific evidence that corroborates that a unique human life starts when the sperm and egg bind to each other in a process of fusion of their respective membranes, and a single hybrid cell called a zygote or one-cell embryo is created. As physicians dedicated both to scientific truth and to the Hippocratic tradition, the College values all human lives equally from the moment of conception or fertilization until natural death. Consistent with its mission to enable all children to reach their optimal physical and emotional health and well-being, the College therefore opposes active measures that would prematurely end the life of any child at any stage of development from conception to natural death. And the report was originally written by Fred de Miranda in March 2004 and was updated in March 2017 by Dr. Patricia Lee June. In the debate on human reproduction, semantics have been used to play an important part, using scientific terms to describe what laymen would call the development of a baby. We've seen the term zygote, a fertilized cell at conception, and we'll also be hearing of a blastocyst. The blastocyst is a structure formed in the early embryonic development of mammals. It possesses an inner cell mass, often abbreviated to ICM, also known as the embryoblast, which subsequently forms the embryo, and an outer layer of trophoblast cells called the trophectoderm. The blastocyst stage occurs between 5 and 9 days after conception. During embryonic development after fertilization, approximately 5 to 6 days in the case of the humans, the cells of the merolla begin to undergo cell differentiation, and the merolla changes into the blastocyst by pumping fluid to grow a lumen. In the uterus, the zona pellucida, or protective coating around the egg surrounding the blastocyst, breaks down, allowing it to implant into the uterine wall. Implantation marks the end of the germinal stage of embryogenesis, which is development of the fertilized egg into an embryo, and the beginning of gestation. And the merolla, which we referenced, in human embryonic development at the 8-celled stage, where the original one cell is split into and becomes 8 cells, having undergone 3 cleavages, the embryo starts to change shape as it develops into a merolla, and then a blastocyst. At the 8-celled stage, the blastomeres are initially round and only loosely adhered. With further division in the process of compactation, the cells flatten onto one another. At the 16-celled stage, the compacted embryo is called a merolla. Once the embryo is divided into 16 cells, it begins to resemble a mulberry, hence the name marula, which is Latin from moros, meaning mulberry. The term embryo means an unborn or unhatched offspring in the process of development. In particular, a human offspring during the period from approximately the 2nd to the 8th week after fertilization, after which it is usually termed a fetus. A fetus is the developing young in the uterus of a vertebrate animal particularly of a mammal, after it's attained the basic form and structure typical of its kind. In humans, the fetus stage is from the 3rd month after fertilization until birth. The term fetus is used to distinguish the unborn baby from the earliest stage of development, which we saw was called an embryo. So to summarize so far, sexual intercourse takes place and millions of sperm enter the vagina. For conception, one of these sperms swims up to the fallopian tube, meets the egg, and breaks through the egg's outer layers to fertilize it. The now fertilized egg, called a zygote as we saw, continues to move down the fallopian tube, dividing into 2 cells. The now fertilized egg, which we saw was called a zygote, continues to move down the fallopian tube, dividing into 2 cells and then 4 more cells. About 1 week after the sperm has fertilized the egg, the zygote has traveled down to the uterus. Now it's a cluster of about 100 cells and is called a blastocyst. The blastocyst then attaches itself to the lining of the uterus, called the endometrium. This process is called implantation. Sometimes implantation does not occur and the fertilized egg is expelled in the next menstrual cycle. If it does implant, the cells continue to divide, some into the placenta and some into the baby. The developing embryo must implant into the wall of the uterus within 7 days, or it will deteriorate and die. The outer layers of the zygote, which is the blastocyst, grow into the endometrium by digesting the endometrial cells, and wound healing of the endometrium closes up the blastocyst into the tissue. Another layer of the blastocyst, the chorion, begins releasing a hormone called human beta-chorionic gonadotrophin, which makes its way to the corpus luteum and keeps that structure active. This ensures adequate levels of progesterone that will maintain the endometrium of the uterus for the support of the developing embryo. Pregnancy tests determine the level of human beta-chorionic gonadotropin in the urine or serum. If the hormone is present, the test is positive. In a way that is not yet understood, the fetus changes the mother's immune system so that the fetus, genetically different tissue from the mother, is not rejected as an invading foreign parasite. The gestation period is divided into 3 equal periods or trimesters. During the first 2 to 4 weeks of the first trimester, nutrition and waste are handled by the endometrial lining through diffusion. As the trimester progresses, the outer layer of the embryo begins to merge with the endometrium and the placenta forms. This organ takes over the nutrient and waste requirements of the embryo and fetus, with the mother's blood passing nutrients to the placenta and removing waste from it. However, at no time does the blood of the mother and the fetus actually mix. Chemicals from the fetus, such as bilirubin, are processed by the mother's liver for elimination. Some of the mother's immunoglobulins will pass through the placenta, providing passive immunity against some potential infections. Internal organs and body structures begin to develop during the first trimester. By 5 weeks, limb buds, eyes, the heart and liver have basically been formed. The heart is beating and pumping blood through the baby's body 21 days after conception. After 30 days, the baby has a brain and brain waves can be recorded after 40 days. By 42 days, the skeleton is formed. The brain controls the movement of muscles and organs, reflexively responds to stimulus, and may be capable of feeling pain. This is before most women know they are pregnant. By 8 weeks, the term fetus applies, and the body is essentially formed. The individual is about 5 centimeters or 2 inches long, and many of the organs, such as the lungs and liver, are not yet functioning. The central nervous system and peripheral nerves develop by the 8th week. It has been shown that a loud noise outside but near the mother's abdomen, a flash of light within the amniotic sac, or pricking the fetal skin with a small instrument, can evoke vigorous fetal reactions, showing that even at an early stage, the fetus is a moving, sensing organism that is capable to responding to changes in its environment. By 9 weeks, a baby will bend fingers around an object placed in its palm, and the baby is sucking his thumb. Exposure to any toxins is especially dangerous during the first trimester, as all of the body's organs and structures are going through initial development. Anything that affects that development can have a severe effect on the fetus' survival. It is estimated that 30% of pre-embryos die prior to implantation, 30% die after implantation but before the next menstrual cycle, and 10% after the missed menstrual cycle. Most die before the mother knows she's pregnant. Of known pregnancies, 15 to 20% end in miscarriage, usually due to chromosomal abnormalities. During the second trimester, the fetus grows to about 30 centimeters or 12 inches. It becomes active and the mother usually feels the first movements around 12 weeks, often in the first trimester. All organs and structures continue to develop. The placenta has taken over the functions of nutrition and waste, and the production of estrogen and progesterone from the corpus luteum, which has degenerated. The placenta will continue functioning up through the delivery of the baby. During the third trimester, the fetus grows to 3 to 4 kilograms, between 6.5 and 8.5 pounds, and about 50 centimeters or 19 to 20 inches long. This is the period of the most rapid growth during the pregnancy. Organ development continues to birth, and some systems, such as the nervous system and liver, continue to develop after birth. The placenta, not the lungs, is the respiratory organ of the fetus. The mother will be at her most uncomfortable during this trimester. She may urinate frequently due to pressure on the bladder from the fetus. There may also be intestinal blockage and circulatory problems, especially in her legs. Clots may form in her legs due to pressure from the fetus on returning veins as they enter the abdominal cavity. During pregnancy, exposure to viruses and bacteria, environmental pollutants, drugs, alcohol and tobacco, and radiation can all damage the development of the baby. Labor and birth. Labor is the physical efforts of expulsion of the fetus and the placenta from the uterus during birth. Toward the end of the third trimester, estrogen causes receptors on the uterine wall to develop and bind the hormone oxytocin. At this time, the baby reorients, facing toward and down with the back or crown of the head engaging the cervix or the uterine opening. This causes the cervix to stretch, and nerve impulses are sent to the hypothalamus, which signals for the release of oxytocin from the posterior pituitary. The oxytocin causes the smooth muscle in the uterine wall to contract. At the same time, the placenta releases prostaglandins into the uterus, increasing the contractions. A positive feedback relay occurs between the uterus, hypothalamus, and the posterior pituitary to assure an adequate supply of oxytocin. As more smooth muscle cells are recruited, the contractions increase in intensity and force. There are 3 stages to labor. During stage 1, the cervix thins and dilates. This is necessary for the baby and placenta to be expelled during birth. The cervix will eventually dilate to about 10 centimeters. During stage 2, the baby is expelled from the uterus. The uterus contracts and the mother pushes as she compresses her abdominal muscles to aid the delivery. The last stage is the passage of the placenta after the baby has been born and the organ is completely disengaged from the uterine wall. If labor should stop before stage 2 is reached, synthetic oxytocin, known as pitocin, can be administered to restart and maintain labor. The stress of delivery for the baby releases hormones which help clear the lungs of fluid and increases blood flow to the lungs and other organs. An alternative to labor and delivery is the surgical delivery of the baby through a procedure called a caesarean section. This is major abdominal surgery and can lead to post-surgical complications for the mother, but in some cases it may be the only way to safely deliver the baby. The mother's mammary glands go through changes during the third trimester to prepare for the lactation and breastfeeding. When the baby begins suckling at the breast, signals are sent to the hypothalamus, causing the release of prolactin from the anterior pituitary. Prolactin causes the mammary glands to produce milk. Oxytocin is also released, promoting the release of the milk. The milk contains nutrients for the baby's development and growth, as well as immunoglobulins to protect the child from bacterial and viral infections. This is the typical development cycle of the baby. Advances in medicine have enabled better monitoring of the baby, and even some incredible surgery on the baby while still in the placenta. This is the story of surgery that was done at 24 weeks on Sarah Switzer. Her parents, Mike and Trish, were understandably excited about having their first child. But the couple's elation over their new addition turned to shock when a routine examination showed that Sarah had spina bifida. There was no prior family history of spina bifida. Trish said she took folic acid and planned everything in the recommended manner to have a healthy child. The diagnosis came on a Friday afternoon, and by the next Monday evening, Mike and Trish were speaking with a perinatologist at Vanderbilt who did in utero repair. After talking with families of a child who had undergone an experimental fetal surgery, Mike and Trish made their decision. "We felt like that was the right thing for us to do," Trish said. 2 days shy of her 24th week of pregnancy, doctors removed Trish's uterus, cut it open, drained the amniotic fluid, and operated on Sarah's back. The procedure was captured by photographer Max Aguilar Helweg, and his iconic picture of a doctor holding Sarah's arm with it emerging from the uterus appeared in the December 1999 Life magazine story, "The Girl Born Twice." Sarah was returned to the womb, where she remained another 7 weeks before being delivered a second time in August 1999. Although born premature, Sarah was able to breathe on her own at 31 weeks. Interestingly, Fox News barred Matt Drudge for showing the photo on TV, as they were concerned he would use it to support his anti-abortion views. As a result, the journalist left the network by mutual consent. The second picture shows a grown-up Sarah participating in water skiing. Is the baby part of the mother's body? Every cell of the mother's body, tonsils, appendix, heart and lungs, shares the same genetic code. The unborn child also has a genetic code, but it's distinctly different from his mother's. Every cell of the baby is uniquely different from the baby's mother, often including the blood type and sex. Half of the baby's chromosomes are from the mother, and half are from the father. Unless the baby is one of identical twins, the combination of chromosomes is unique. One body is inside another body, both having unique genetic codes. Then there are 2 people, not one. The mother influences the fetus, providing it with nutrition, oxygen, antibodies, and hormone for its growth. The fetus reciprocally influences the mother, changing her blood circulation, immune responsiveness, and metabolism, while providing her hormones to retain the pregnancy. Is the baby a blob of cells until a certain point in the pregnancy? The word embryo is used of any living creature at an early stage of development, and fetus is Latin for young one or little child. It is scientifically inaccurate to say an embryo or fetus is not a human being because they are at an early stage of development. A baby after birth is a human being, but less developed than a toddler, who is in turn less developed than an adolescent, who in turn is less developed than an adult. We will come back to this issue when we consider the message, "The Christian and the Ethics of Human Reproduction." Advances in technology have allowed us to see into the womb, so we know that this is not the case, that the baby is a blob of cells. We repeat here the statement of the American College of Pediatricians. The difference between the individual in its adult stage and in its zygotic stage is one of form, not nature. The college therefore opposes active measures that would prematurely end the life of any child at any stage of development, from conception to natural death. We have seen that some fertilized eggs naturally die if they do not implant in the lining of the uterus, as well as miscarriages that occur during pregnancy. So now let us look at interventions in human reproduction. Abortion. From a medical definition, abortion is the expulsion of a fetus from the uterus before it has reached the stage of viability. In human beings, usually about the 20th week of gestation. Many general reference definitions lack the reference to viability. An abortion may occur spontaneously, in which case it is called a miscarriage. An induced abortion is the termination of an implanted embryo by artificial measures. Spontaneous abortions or miscarriages occur for many reasons, including disease, trauma, genetic defect, or biochemical incompatibility of mother and fetus. Occasionally a fetus dies in the uterus but fails to be expelled, a condition termed a missed abortion. Terminating a pregnancy by induced abortion terminates a human life. Approximately 21% of all known pregnancies worldwide end in abortion. Induced abortions to prevent harm to the mother are known as therapeutic abortions. So now let us turn to active measures. Contraception. Prior to 1976, a contraceptive was understood to be an agent that prevented the union of sperm and ovum, or egg. In 1976, the American College of Obstetricians and Gynecologists, or ACOG, changed the definition to contraception refers to methods that prevent pregnancy by either preventing fertilization of an egg or by preventing the implantation of a fertilized egg. These methods can include hormonal and non-hormonal options. Contraception can be used temporarily or for permanent sterilization. As we have seen, life begins at conception when the egg is fertilized. Contraceptives that work by preventing a fertilized egg being implanted in the uterus are actually abortifacients that result in the death of a fertilized egg. Contraceptives such as IUDs, abortion pills, emergency contraception pills, and other contraceptives not only act in the traditional sense of contraceptives, of preventing fertilization, but in cases when they fail, they also have another effect of preventing implantation in the uterus lining. This effect is in many cases not told to women using the contraceptive method. In addition, after the introduction of the pill, high doses of estrogen that prevented ovulation were found to have undesirable side effects. As a result, the estrogen levels were reduced from 150 micrograms to 50 micrograms or less. WebMD advises hormonal contraceptives, the pill, the patch, and the vaginal ring, all contain a small amount of hormones. These hormones inhibit your body's natural hormones to prevent pregnancy in a few ways. Hormonal contraceptives usually stop your body from ovulating. They also change the cervical mucus to make it difficult for the sperm to go through the cervix and find an egg. They can also prevent pregnancy by changing the lining of the womb, so it's unlikely the fertilized egg will be implanted. How many babies are aborted at this early stage by contraceptives is known only by God. Do women who use these contraceptives know how they work? Do pro-life supporters using the pill understand these mechanisms? That if the pill does not prevent ovulation, and then does not prevent the sperm reaching the egg, will work by preventing the fertilized egg implanting in the lining of the uterus. Even the literature can be confusing. Levonorgestrel is a hormonal medication which is used in a number of birth control methods. It's combined with an estrogen to make combination birth control pills. As an emergency birth control sold under the brand names Plan B, One Step, and Julie, among others, it's useful within 72 hours of unprotected sex. The primary mechanism of action of levonorgestrel as a progesterone-only emergency contraceptive pill is, according to International Federation of Gynecology and Obstetrics, to prevent fertilization by inhibition of ovulation and thickening of cervical mucus. FIGO has stated that review of the evidence suggests that LNG or levonorgestrel ECPs cannot prevent implantation of a fertilized egg. Language on implantation should not be included in LNG ECP product labeling. And in November 2013, the European Medicines Agency, or the EMA, approved a change to the label saying it cannot prevent implantation of a fertilized egg. Other studies still find the evidence to be unclear. While it's unlikely that emergency contraception affects implantation, it's impossible to completely exclude the possibility of a secondary post-fertilization effect. The levonorgestrel intrauterine system, or LNG-IUS, is a type of long-term birth control that releases the progestin into the uterine cavity. Here, the LNG is released at a constant, gradual rate of 0.02 milligrams per day by the polydimethylsiloxane membrane of the device, which renders it effective for up to 5 years. Because it's inserted directly into the uterus, the LNG is present in the endometrium in much higher concentrations than would result from a LNG-containing oral pill. This high level of levonorgestrel impedes the function of the endometrium, making it hostile for sperm transport, fertilization, and implantation of an ovum. Both Cleveland Clinic in a 2022 article and a 2024 National Health Service Inform booklet report that copper IUDs can prevent implantation if the sperm are not killed before fertilization. The NHS also confirms that an IUS thins the womb lining, making implantation of a fertilized egg less likely. In the USA, there were an estimated 930,000 abortions in 2020, down from a high of 1.6 million in 1990, from the Guttmacher Institute. An estimated 53% of these abortions involve pills, which was up from 39% in 2017. These figures do not include abortions that use pills obtained outside of clinical settings. From CDC figures which are not complete, these take place as following: 45% in under 6 weeks from gestation, 35% between weeks 7 and 9, 12% between weeks 10 and 13, 2.7% between weeks 14 and 15, 1.6% between weeks 16 and 17, 1.5% between weeks 18 and 20, and 0.9% greater than week 21. Although, as noted, these figures are incomplete, being approximately 50% of the reported abortions for the year. Truly effective abortifacients were not developed until the end of the 20th century, when the biochemical processes behind cell division and growth and the role of hormones in reproductive processes were understood. The most common agents of modern medical abortion include mifepristone, also known as RU486, a steroid, and methotrexate, an antimetabolite. Both are used during the early weeks of pregnancy in conjunction with the synthetic prostaglandin misoprostol, administered in prescribed doses either orally or as a vaginal suppository, causes the uterus to contract much as it would at the beginning of labour or during a miscarriage. Taken alone, it's rarely sufficient to expel the embryo and placenta from the uterus, but is very effective as a sequel to treatment with mifepristone or methotrexate. Mifepristone works by competing with progesterone for receptors on cells. By occupying receptor binding sites, it prevents the hormone from stimulating the inner lining of the uterus to prepare for implantation by a fertilized ovum. When administered early in pregnancy, mifepristone causes the breakdown of the uterine lining. A follow-up dose of misoprostol induces expulsion of the embryo and other uterine contents. Methotrexate, administered by injection, blocks the rapid cell division characteristic of embryonic and placental growth. Once this growth is ended, administration of misoprostol completes the abortion. By 2020, the two-drug combination, commonly referred to as a medication abortion or the abortion pill, accounted for more than half of all abortions in the United States. The US Food and Drug Administration, or the FDA, approved sending abortion pills through the mail during the COVID-19 pandemic. First temporarily, and then, based on the evidence of its safety, permanently. Before then, women had to see a doctor at a clinic or hospital to get mifepristone, which is the first of the two drugs used in the medication of abortion. Since the US Supreme Court overturned the constitutional right to abortion, medication abortions have become increasingly common. Nearly 2/3 of all US abortions in 2023 were done with medication, researchers said. Numerous medical techniques exist for performing abortions. During the first trimester, up to about 12 weeks after conception, endometrial aspiration, suction, or curettage may be used to remove the contents of the uterus. In endometrial aspiration, a thin flexible tube is inserted up the cervical canal, the neck of the womb, and then sucks out the lining of the uterus, the endometrium, by means of an electric pump. In the related but slightly more onerous procedure known as dilation and evacuation, also called suction curettage or vacuum curettage, the cervical canal is enlarged by the insertion of a series of metal dilators, while the patient is under anesthesia, after which a rigid suction tube is inserted into the uterus to evacuate its contents. When in place of suction, a thin metal tool called a curette is used to scrape rather than vacuum out the contents of the uterus. The procedure is called dilatation and curettage. Dilatation and curettage, or D&C, is a surgical procedure used for abortion where the cervix is dilated and a curette used to scrape the walls of the uterus to remove the pregnancy. It is considered an outdated method, having largely been replaced by vacuum aspiration techniques. D&C is typically performed in the first trimester and can also be used for other medical reasons such as treating miscarriages. The procedure usually lasts about 10 to 15 minutes and carries risks such as infection. When combined with dilatation, both evacuation and curettage can be used up to about the 16th week of pregnancy. In the second trimester, 13th to 24th week, induced abortions are more complicated and riskier to the mother. After the 19th week, the maternal death rate due to abortion is higher than the death rate for childbirth. The death rate for the fetus is the same at 100%. Dilatation and evacuation, D&E, is a surgical procedure used for abortion or management of miscarriage. It's performed in the second trimester of pregnancy and involves the combination of dilation, vacuum aspiration, forceps, and curettage. The procedure removes the fetus and all placental tissue from the uterus. What happens during a D&E abortion? Cervical preparation. Cervical preparation is recommended for all pregnancies over 12 to 14 weeks to reduce the risk of complications. Dilating the cervix adequately is especially important for 4 groups of women. These include teenagers, women with abnormal cervical anatomy, Women who've had medical procedures done to their cervix before, such as a colposcopy, or cervical biopsy, or LEEP, a loop electrosurgical excision procedure, and women past 20 weeks gestation. All of these groups have a higher likelihood of injury to the cervix and perforation or puncture of the uterus. Different combinations of medicines and sometimes sterilized seaweed called laminaria, or long thin synthetic rods called dilapan S, or medicated sponges called Lamisil, may be used to dilate or open the cervix so that the abortion tools and fetal body parts can fit through. The sponges and laminaria swell to absorb the amniotic fluid, forcing the cervix open. The medications chemically cause contractions and cervical softening and opening. One combination of medicines include the same two medications, misoprostol and mifepristone, which are used for medical abortion in the first trimester. Dilation of the cervix varies from one abortion doctor to another. Some of them start the process 2 days before the abortion, some the day before the abortion, and some just 4 hours before the abortion is performed. Often antibiotics will be given when the laminaria or other synthetic materials are placed to prevent infection. More laminaria or dilapan S or Lamisil may be added to the cervix every few hours, or what's currently in place may be removed and new materials may be placed. Procedure day. The day of the abortion, a brief history and physical are performed. Blood samples are taken to check for sexually transmitted infections. An antibiotic pill will be given and an ultrasound will be done. After the cervix has been dilated, the dismemberment and removal process only takes about 30 minutes. The woman may be given pain medication such as ibuprofen, anti-anxiety medication such as Valium, and some type of local anesthesia shot or shots to numb the cervix. Sometimes intravenous sedation, medicine, or general anesthesia are given, since D&E is associated with significant pain. But general anesthesia also has higher complication rates than local anesthesia. Dilation and extraction. Once the pain and anxiety medications are given, the abortion doctor inserts a speculum, the same cold metal gripping tool used during pap smears in OB/GYN offices. The speculum may be weighted if the woman is past 16 weeks along. The speculum widens the vagina and makes the cervix more visible, so that the abortion doctor can see what he or she is doing. A tenaculum is a gripping instrument with long handles and a clamp at the end that moves the cervix closer to the vaginal opening. Tenaculum may have sharp metal teeth to hold the cervix in place. Ultrasound is often used to guide the abortion doctor. Dilators such as dilapan S or Lamisil or laminaria are removed. If the mother is less than 16 weeks along, the abortion doctor may be able to suction out the fetal parts, like in a vacuum abortion. Once the fetus is older than 16 weeks, though, forceps are required. Forceps are grasping instruments used to grasp, crush, twist, and pull fetal body parts, such as arms and legs or pieces of arms and legs out. The fetal head and spinal column often have to be crushed before they can be removed, especially the farther along the woman is. After the body parts are removed, the placenta is suctioned or scraped out, usually with the abortion doctor placing his hand on the woman's stomach to help feel for it in the uterus. After this, the abortion doctor or other staff have to reassemble all of the body parts to make sure that no fetal bone or other tissue remains. At what point does the fetus die during the abortion? The World Health Organization suggests inducing fetal demise, making sure that the fetus is dead before the abortion for women 20 weeks or more pregnant. This is because the fetus is easier to dismember if it's not moving. The two medications used together for first trimester medication abortion do not technically cause fetal death. In those abortions, the fetus typically dies during the violent contractions they cause. Similarly, and because the fetus is bigger, when one or both of those medicines are used to dilate the cervix before a second trimester abortion, like a D&E, they are not expected to cause fetal death. Fetal death is typically achieved through injection of a medication such as potassium chloride or digoxin into the amniotic sac that holds the fetus. Potassium chloride is very effective, but it requires a highly skilled doctor because accidentally injecting it into the mother's bloodstream could kill her instead of the fetus. Potassium chloride kills the fetus almost immediately, and the abortion doctor uses ultrasound to watch for the heart to stop beating. Digoxin, on the other hand, takes more time to stop the fetal heartbeat, but is safer for the woman, especially in cases of accidental injection into her bloodstream. It is less effective than potassium chloride in killing the fetus, and because it takes longer to act, is often given 1 day before the abortion. This means an additional office visit for the woman seeking an abortion. When fetal death is not induced before the D&E, the fetus dies when the abortion doctor crushes its skull with large forceps. From 12 to 19 weeks, the injection of a saline solution may be used to trigger uterine contractions. Alternatively, the administration of prostaglandins by injection, suppository or other method may be used to induce contractions, but these substances may cause severe side effects. Hysterectomy, the surgical removal of the uterine contents, may be used during the second trimester or later. The textbook on human reproductive biology goes on to say, one negative aspect of these hysterectomies is that the fetus may be delivered alive and then left to die of respiratory failure, a disturbing task for all persons involved. In general, the more advanced the pregnancy, the greater the risk to the female of mortality or serious complications following an abortion. Hypertonic saline-induced abortion, also called saline abortion, is a procedure used to terminate pregnancies in the second and third trimesters. This abortion method involves injecting hypertonic saline, a type of concentrated salt water, into the mother's uterus. Although it was once a fairly common abortion procedure, doctors rarely use hypertonic saline-induced abortions anymore because of the associated health risks. There are now much safer methods for abortion after the first trimester, including vacuum aspiration and dilation and evacuation. These methods also cause less physical discomfort and are quicker. While outdated abortion methods like saline abortions are considered dangerous, the abortion methods used commonly nowadays are considered very safe and effective for the mother. In late second trimester and early third trimester, intact dilation and extraction, or DNX, or partial birth abortion is performed. This first involves administration of medications to cause the cervix to dilate, usually over the course of several days. Next, the physician rotates the fetus to a footling breech position. The body of the fetus is then drawn out of the uterus feet first until only the head remains inside the uterus. Then the physician uses an instrument to puncture the base of the skull, which collapses the fetal head. Typically, the contents of the fetal head are then partially suctioned out, which results in the death of the fetus and reduces the size of the fetal head enough to allow it to pass through the cervix. The dead and otherwise intact fetus is then removed from the woman's body. This process was banned in the USA in late 2003. As it was a federal law ban, it should still be in place after the recent overturning of Roe v. Wade in 2022 and putting abortion restrictions under the control of the individual states. As we conclude our look at the science of human reproduction, there can be no doubt that we are fearfully and wonderfully made. Psalms 139:14. While there may be theological doubt as to when the human being becomes a spiritual being, there is no scientific doubt that life begins at conception. We have seen the wonderful intricacies between baby and mother that show while the baby is in the mother's body, it is separate and distinct from the mother's body. What this means, or should mean to us, we will examine in our next message, The Christian and the Ethics of Human Reproduction. And for those of you who found some of this message distasteful or difficult to listen to, part of our problem today is that because so much of it is out of sight, it is out of our minds. Jesus said, "If you abide in my word, you are truly my disciples, and you will know the truth, and the truth will set you free." It's my belief that in knowing the truth as to how human reproduction works and what is being done, in many cases, 20% of pregnancies worldwide end in abortion. We need to know how that happens and what happens, because we will be held accountable. It's not enough to say that we didn't know. If we know the truth and we find it distasteful, then we should advocate against abortion. Or if we know the truth and we find it acceptable, then we have to live with the consequences of those decisions. And again, this is something that we will explore more in our next message, The Christian and the Ethics of Human Reproduction. Shall we pray? Dear Heavenly Father, we come before you today, humbled, repentant, pleading for lost generations of children who have been aborted before being born. You know each and every one according to your word. Before they were born, you knew them in the womb. Lord, we pray that people will know the truth and they may be set free and make reasoned decisions that reflect the goodness of the humanity of man and women, that we are our brother's keeper. Even our brothers who are not yet born, we are our brother's keeper. May the truth of Christ be in us to proclaim the word. Your word says that true religion is looking after the widows and orphans. May we also have a heart for the young, the unborn, those who are born in stressful family situations or social situations, for those who have been taken advantage of by others, whether it be economically, sexually, or however else it is. Father God, may we be more like you every day. May we be carriers of the gospel to enlighten the world and proclaim the hope that is found in Jesus Christ, our Lord and Savior. Amen.